Not only is tomorrow the start of a new year, it's also the start of Cervical Health Awareness Month. Joining me via Zoom this morning is Dr. Adam Ryan, an OBGYN for Marshfield Medical Center, Dickinson. So today we're talking about women's health. And Dr. Ryan, how often should women take preventative measures and visit their doctor regarding this?
I think that a woman needs to be seen for a general health preventative exam once a year. That doesn't have to be an OBGYN. It could be a family physician or another type of primary care provider that is doing the proper screening for women. Generally, that includes cervical screening for cervical cancer, the HPV screening. So I tell women when I see them, like at the end of a pregnancy care, I say, do you see your family doctor for annual exams? Do they perform a pelvic examination and breast examination? If they say yes, then I'm fine with them seeing their family doctor for that. But if they say no, I don't have that provider, or my family doctor is not, usually doing that type of examination, isn't comfortable with it or whatever, then I do make sure that they see their OBGYN.
When it comes to pap smears, how often should patients have that done?
We did the traditional pap smear every single year. And then a while back, somebody finally did the research that asked the question, how often should we really be screening for human papillomavirus that causes these abnormalities on a woman's cervix? And the answer came back about every 3 years we should do a pap smear, not every single year. What we discovered is that by doing it every year, we were doing too many other procedures, leading to some over use of other biopsies and things. And by doing it every 3 years, we were allowing the body's own immune system to kind of take care of the HPV exposure that they might have gotten. But 3 years is not enough time to go by that we're not going to catch the problem. So I do want to emphasize that sometimes when we say pap smear and then we also say pelvic exam, a lot of patients misunderstand, and they hear that when they hear they don't have to have a pap smear every year, they also hear me say that they don't have to have a pelvic exam every year. And I want to emphasize that those are two different things. A pap smear and cervical screening, they don't happen every year now, but an examination of that area of the body should happen every single year.
How serious is cervical cancer?
Cervical cancer there's roughly 13,000 cases of cervical cancer diagnosed in the United States every year, and about 4,000 women die every year of cervical cancer. And it's really a sad situation because it's completely preventable. If everybody was just doing their proper screening for HPV, which is the virus that causes the changes in the cells of the cervix that lead to the cancer, if we did more with vaccination, we could prevent this awful cancer. And it is truly an awful cancer. One cervical cancer it has a relatively poor survival rate, just because compared to some other cancers, because it's often caught somewhat late. By the time I see somebody who clearly has a cervical cancer and they've been having some abnormal bleeding or some pain or some trouble with urination or something, it's often quite advanced. And then the treatments are really not great. They're difficult times ahead for that patient. They've got the battle of their life on their hands, and it's not a fun thing to watch your patient have to go through.
What's one last message you have for people in fighting this disease?
It's one of those things where we hear as physicians all the time, oh, when are they going to find a cure for cancer? When are they going to find a cure for this awful disease? And I mean, the trouble with that is there's so many different types of cancer, but here we have a cancer that is caused 100% of the time by human papillomavirus. And we have a vaccine for the virus that is extremely effective, but we have a very low vaccination rate compared with other countries. If we can just get at those kids that are 11 and 12 years old and get them in for vaccinations, we will do so much good to prevent this awful disease. So this is completely preventable. And then beyond the vaccination, then of course we have the cervical screening, which starts after age 21 and continues till about age 65. And if we just did that every 3 years on women as we should, if those women got to their appointments. I mean, sometimes it's a situation where in certain areas of the country there's a lack of access to care. We have, in some rural areas, for instance, in the UP, some difficulties with distance to get to a doctor and things like that. So I understand there are some barriers, and we need to do what we can to limit those barriers. But I'm here to just say, as an OBGYN, and I'll speak for the rest of my colleagues, the doors are open, wide open. Just come on in and let's talk about what we need to do to help prevent this awful disease.
Thank you, Dr. Ryan. We'll have this chat with him and resources available on myupnow.com. Stay with us, and we'll be right back after the break.